Today we are going to be talking about responding when anonymity feels like a blocker. So I know this is something that comes up a lot, which is why we wanted to have a webinar about it and really talk into it. So one of the most common things we hear from services is we'd love to respond, but we don't know who this person is. And without knowing who wrote the story, it can feel difficult to investigate what happened or provide meaningful answers. We want to show that anonymity isn't a barrier to good responses. So in fact, it's one of the reasons care opinion works so well. So let's get into it. Let's have a bit of a look. So today, we're going to explore why anonymity is such an important part of care opinion and how different types of anonymous stories require different approaches. And we'll also be looking at practical ways to write meaningful responses even when information is limited. So, why anonymity? Why do we have anonymous feedback in the first place? So, before we can talk about responding, it's important to understand why it's valuable in healthcare to have anonymous feedback. So, my first point might sound a bit strange, but it is because we want all feedback. So, many people simply wouldn't share their experiences if they had to reveal their identity publicly. And they may worry also about being judged, having their care affected in the future, upsetting staff, or simply perhaps they just want to move on from a difficult experience. So storytellers also sometimes don't even want to create a big deal with their feedback, and they just want to inform. So it's also worth remembering that anonymity isn't just about protecting the author. It also encourages more open conversations about care. So yeah, we need anonymity because if we want all feedback and we don't just want to get feedback from people who are willing to have their identity shared, then we also have to have that anonymous feedback. Brilliant. Awesome. So I wanted to touch base a little bit on a study that's being done on care opinion. So we have got a study that examines, in Scotland, how healthcare staff responded to anonymous patient feedback posted online through care opinion. So it was conducted in the UK on a Scottish hospital, and it found that nearly everyone interviewed recognised that patients may fear retaliation when posting feedback. So that's a big theme that comes up. Patients worry that if they complain, their future care may suffer. And an interesting insight in the article is that staff themselves felt emotionally exposed with anonymous public feedback. So it really isn't just a challenge that's unique to an Australian healthcare setting. It's across all healthcare settings, or at least Australia and the UK. And I've got this quote, once it pops up, that we had, that's in the article. It's by Lowcock, and I'll link to it after the presentation. But the staff member who was interviewed had posted on Care Opinion anonymously when they had been on the receiving side of care, and that actually that experience enabled them to have more empathy for patients who do the same thing. So this quote is from that staff member and basically shows that they finally understood why people stay anonymous. Even when they worked in the hospital themselves, they posted their own story and they didn't want to identify themselves either. So it made them realize that not everyone wants to be contacted. And for this staff member in the quote, you can see they just want their feedback to lead to change. So instead of focusing on finding out who the patient is, the hospital could perhaps focus on what they could learn from the feedback. So that was quite interesting, and you can go through and have a look at that in the article because it's a staff member actually agreeing with that anonymity. I mean, it's a lot easier said than done though, hey. So hopefully after this webinar, we come away with some tips on how to deal with anonymous feedback. So this is also from the Lowcock article, a bit of pros and cons with anonymous feedback. I know that's probably very small on the screen, but I'll have it in the follow-up communication. So just a little bit to have an idea of what can be good and what can be really challenging when dealing with anonymous feedback, because of course with a situation like this there are pros and cons, and we do have to understand that. So because of this pros and cons, Lowcock and the authors actually describe anonymity as, a paradox in healthcare. Patients really value anonymity, whereas healthcare staff often see it as a barrier. So essentially, the article recognizes that although anonymity can create discomfort, and Lowcock describes how it shifts traditional power relationships, it still provides really valuable insight for improving care, which brings us back to that data sampling theme I mentioned earlier, that if we want all feedback, then we need anonymous feedback. So how can we mitigate these challenges, and how can we mitigate these cons with anonymous feedback? Well, the first way we can do this is to understand the types of anonymous feedback we may receive. And of course, this is just a really broad definition. The first is personal feedback. So these stories describe a person's individual care experience. They often relate to a specific interaction, appointment, or episode of care. They can include concerns about the treatment they received. And because these stories relate to a particular person's experience, services often feel they need to identify the patient or the exact event before they investigate or respond. So we do have these stories, and I'm sure as soon as I, talked into this one, we can recognize it immediately. A lot of stories that we receive from Care Opinion fall into this very personal experience that as healthcare workers, we often will need to see, the medical records, or we'll need to identify the patient to really understand what's going on. So this is the more trickier of the two. And then, of course, we've got the environmental slash system story. So rather than focusing on one person's circumstance, these stories are about the healthcare environment. So it could be, parking, signage, facilities, and so on. So these issues often affect many people, not just the person who wrote the story. And in these cases, identifying the author, it's less important, because we can see that the issue can be usually understood and addressed without knowing who experienced it. So the way we respond to these two types of stories can be slightly different, and should be slightly different. So I'll go into it, but we'll start off with the easy one. So there's a story here. It's an older story. It's from New South Wales, and of course I'll include this as well in my email. But it was a women's and newborns hospital, and it was undergoing renovations, and as such there was no breastfeeding rooms. So the author talks about her own experience. The issues she's raising isn't really about her individual care, though. It's really about that environment in the facility. So she's obviously not asking the hospital to investigate a staff member, but she's just highlighting what is a broader issue, which is that lack of a dedicated space for breastfeeding during ongoing hospital renovations. So how did the health service respond to it? Well, it actually led to a change, and these stories that are about environmental factors are really quite easy to make a change to a lot of the time. So instead, they sort of responded to the issue that had been raised. And of course, they didn't really need to know the patient's identity, but they explained that, maternity managers considered that feedback, and, they identified an interim solution by creating a secure breastfeeding space and communicated that solution to staff so future families could be directed there. So if anything, the author's anonymity becomes quite irrelevant in these stories. It's very easy to talk into these and make a change. But we'll compare that now with a very different type of anonymous story. So one where the author is describing a very specific episode of care. So this story, it's quite long. So I'll just give you a little bit of a breakdown, but I'm sure it will come quite familiar to a lot of you who read stories. But, it's a patient's experience. They've attended an immunology appointment to discuss abnormal test results, and they felt that the doctor had not reviewed their results, that they dismissed their concerns and spoke to them disrespectfully. So the patient then had to push for a biopsy that had already been recommended in their scan report. And as a result, they left feeling unheard and, that their health concerns were still unaddressed, and saying that they felt hopeless and intended to make, a formal complaint. So when we get a story like this, it is quite easy to see why, as a health service, we might feel that anonymity is a barrier here. And we might think, we need to know who this patient is. We need to actually look at their records and talk to the clinician and find out what happened here. And that is true. But let's have a look, because it was responded to quite well. So in the response, it acknowledges the author for speaking up, and of course it explains the limitations of anonymity. It invites the author to make direct contact, confirms the feedback has still been shared, and that's the really important part, and I've noted it with an arrow. Because it's saying, even with your feedback being anonymous, this is what we can do. And a lot of times, all we can do is share that feedback with staff, or, talk to the clinical team about it, talk to someone about it. And you can write that in your responses. And it's a really great way of just showing that, hey, if you contact us, we can do much more. But even with you staying anonymous, your feedback has been shared. And a lot of times patients are just happy with that. They don't necessarily want to have an investigation. They just want their experience to be shared, and for any teams to take what learnings they may from that situation. So I thought this response was quite good. Now, I have mentioned this in a previous webinar, but it often comes back to this idea, and this is, what makes care opinion, in my opinion, so great, is that we with public narrative feedback, we've always got this relationship that's two-way with each story. So we've got the response with the author, but then we've also, of course, got the response for the public. So with an anonymous story, it's quite easy to focus solely on the author and think, well, we can't really do much unless they identify themselves. But remember that every care opinion response, we should be asking ourselves, what do we want the public to know as well? So we do want them to know that we take concerns very seriously. Perhaps we want them to understand the process we'll follow, why we may need the author to contact us to investigate the specific appointment, for example, and importantly, what we're going to do even if they choose not to make contact. So, for example, we can explain that the feedback has been shared with the relevant departments, such as in the earlier response, or even, the issues raised will be discussed with the team. The story will contribute to ongoing service improvement. Essentially, you're sort of wanting every story, even if you do need to really make a tangible change, you do need to identify the author, you can still share that with the team. I think that's quite important. I recently had a conversation with a uni student who was a nurse, who I ran into at university when I was, writing my honours, which I just finished, and I told her about care opinion, and so she went, oh, that's great, and she had a bit of a read through stories, and she said, this, honestly, I haven't even started practicing yet, but I'm already learning so much. So, and of course she doesn't know the identity of authors, so we can't really forget the power that an anonymous story can have on someone, even if it's just something that they remember when they go into their next appointment. It's quite powerful. So yeah, we do want to remember that we've got that conversation with the public, and what do we want the public to know? So this is a response that I've talked about as well. And it's just, it really, really effortlessly does this. So, the author to this story hadn't actually reached out to Chloe, but she published a follow-up response and said, even without you getting in contact with me offline, this is what I've been able to do. And so she's really talked into, the actions that she's taken, which is, to review I think it was the wait time in emergency departments, and see how long it is, and, or review similar feedback, or, have a look into something. So this is how she dealt with anonymous feedback, and also how the public learnt more about how the health system works. So yeah, giving a little bit of a glimpse behind that curtain. So key takeaways as I finish up is anonymity can absolutely make responding more challenging. So there's no denying that, but it's also essential if we want to access the full range of patient experiences. And with many anonymous feedback channels, it's really hard to respond to the author unless it's through a third party. So at least, on Care Opinion, you can respond to that anonymous feedback. So secondly, it can be helpful, again, as I mentioned, to think about anonymous stories as those two categories. So we have those personal stories and those environmental or facility stories. And so one is a lot easier than the other to respond to and to really make a change with. And then we've also got, at the same time, that conversation with the public. So we can explain what identifying the author, would allow us to do. And we might say, if you choose to contact us, we'll be able to review your medical records. But yeah, we're really wanting to communicate these two things. And, that leads into the public, that, we'll do this regardless. But if you, identify yourself, we'll have more ability. But yeah, thinking about what the public wants to know. What do you want the public to take away? And because these conversations happen publicly, they do so much more than resolve one person's concern. So they can educate and reassure and build trust. Just like I mentioned about my nursing friend at university. So that was just one story, and from, a different state that made a difference to her. So yeah, I'll stop the recording there.